It is okay, madam, now? Now you check, madam.
Yes, sir. Yes, sir. Hello. Am I
Yeah,
audible,
madam,
sir?
please proceed.
Shall
Yeah, madam, please proceed.
All right, sir. Um, Hello, everyone. Welcome to Tawhid Foundation at Allied Healthcare Sciences, Bangalore. So today's class is about Parasitology Part 2 for BSc MLT second year students. We'll begin with introduction. So, medical helminthology is concerned with the study of helminths or parasitic worms. Helminthes are trophoblastic metazoa multicellular organisms. Helminthes are among the common parasitic cause of human suffering. They are the cause of high morbidity, mortality of people worldwide. They cause different disease in humans, but few helminthic infections cause life-threatening diseases. They cause anemia and malnutrition. As you can see here, it causes morbidity, anemia, malnutrition, reduced academic performances. So in children, they cause a reduction in academic performance. Helminthes also cause economic loss as a result of infections of domestic animals. There is age-dependent distribution of infection from geohelminthes and schistosomes as a result of predisposing behavioral and immunological status. So, children disproportionately carry the burden of schistosomes and geohelminthes. Sources and transmission. The sources of the parasites are different. Exposure of humans to the parasites may occur in one of the following ways, that is, contaminated soil through geohelminthes, water, blood fluids, and food, that is, tinea in raw meat. Second is blood sucking insects or arthropod, as in filarial worms. Third is domestic or wild animals harboring the parasite, as in Echinococcus in dogs. Fourth is person to person, as in Enterobius vermicularis. Last is highly menthocyana, that is oneself auto-infection, as in Enterobius vermicularis. So they enter the body through different routes, including, that is, mouth, skin, and the respiratory tract by means of inhalation of airborne eggs. So, classification, the helminthes are classified into three major groups. First is trematodes, that is flukes or flatworms. Second is nematodes, that is nothing but roundworms. Third is cystode, that is tapeworms. So, the trematodes and cystodes are a group of these worms, flatworms. So we'll begin with trematode, that is flukes. Trematodes belong to the phylum Platyhelminthes. They are found in wide range of habitats. The great majority inhabit the alimentary canal, liver, bile duct, ureter, and bladder of vertebrate animals. Adult flukes are leaf-shaped flatworms, prominent oral and ventral suckers, help maintain position in situ. Fluke worms are hermaphroditic except for blood flukes, which are bisexual. The life cycle includes a snail intermediate host according to the site they inhabit. So there are four group of flukes. These are blood flukes, intestinal flukes, liver flukes, and last is lung flukes. So we'll start with blood flukes, that is schistosoma. So these are flukes that reside mainly in the blood vessels of various organs. The schistosomes are the prototype and the commonest flukes in our country. Schistosomiasis. It is estimated that about 600 million people in 79 countries suffer from schistosomiasis. This schistosome causes intestinal, hepatosplenic, pulmonary, urogenital, cerebral, and other form of schistosomiasis. So this is the structure of flukes. This one is hermaphroditic fluke and second is bisexual fluke. So schistosome is the only fluke with separate sexes. The female worm lies in the gynecophoral canal of the male. This condition is important for transportation. So here there are five medically important species. First is Schistosoma mansoni, which causes intestinal schistosomiasis. Second is Schistosoma hematobium, which causes vesicle, that is urinary schistosomiasis. Third is Schistosoma japonicum, which causes intestinal schistosomiasis. Fourth is Schistosoma intercalatum, which causes intestinal schistosomiasis. And last is Schistosoma meconiae. This causes intestinal schistosomiasis. So this seems to cause milder disease in men. The last one, which is meconiae. It causes disease in other vertebrate hosts, but the first two schistosome, that is Schistosoma mansoni and hematobium, are prevalent. Its habitat, these species live in the veins of the intestine. Morphology is the male ranges in size from 1 to 1.4 centimeter in length and the body is covered by coarse tubercles. It has 6 to 9 testicles. The female is around 1.5 to 2 centimeter in length. The ovary is present in the anterior third and vitelline glands occupy the posterior two-third. It lays about 100 to 300 eggs daily. This is the life cycle of schistosomes. So this schistosomes life cycle, adult worms reside in pair, the female lying in the gynecophoral canal of the male. After fertilization, eggs are passed into the venules. A larval form from the meridium develops within the egg. Its lytic enzyme and the contraction of the venule rupture the wall of the venule, liberating the egg into perivascular tissue of the intestine. So this life cycle and symptoms. Symptoms and complication. Patient infected with schistosoma suffer from terminal hematuria, that is presence of blood in the urine and urination. There is inflammation of the urinary bladder, cystis, cystitis, and enlargement of spleen and liver. Patients infected with schistosoma mansoni suffer from cervical dermatitis, that is swimmer's itch, and dysentery, which is mucus and blood in stool, as well as enlargements of the spleen and liver. Patients suffer from schistosoma hematobium. It causes squamous cell carcinoma, a form of cancer in the bladder. So host defense against schistosomes include antibody or complement dependent cellular cytotoxicity and modulation of granulomata, defenses against hermaphrodite flukes which are unknown. Laboratory diagnosis include stool and urine exam for egg, microscopic examination of the stool for eggs after concentration by sedimentation method. The egg has characteristic lateral spine, rectal snip, and hematobium. So examination of the urine after allowing it to sediment in urine analysis gas, a drop from the sediment is taken and examined for the presence of these eggs. Egg has terminal spine. Biopsy from the bladder can go for diagnosis. Treatment choice of this drug, praziquantel, will be given to the patient. Next is fasciola. So fasciola hepatica, it is caused because of ship liver fluke. It is common parasite, cosmopolitan in distribution. It is large in shape, around 3 centimeter in length. Adult worm reside in the large biliary passage, and gallbladder. So gigantica, this fasciola gigantica lives in the liver of cattle. Human infections are very rare in these cases. So fascioliasis is caused by fasciola hepatica and less often caused by fasciola gigantica, which are fat worms classified as liver fugues, that is trematodes. Some human cases have been caused by hybrid species. Additional fasciola species have been found in animals. Snail's intermediate host is of the genus Limnia. So symptoms of fascioliasis include biliary colic with vomiting, persistent diarrhea, and a tender hematomegaly with peripheral eosinophilia. It is the most common in sheep and cattle raising countries. Fasciola hepatica is primarily responsible for producing a disease in animals which is known as liver rot. During migration of the young worms and their localization in the biliary passages, they cause extensive damage to the liver and in heavy infections, which may lead to portal cirrhosis, while in the biliary passages, they may interfere with normal flow of bile, causing obstructive jaundice. So, the mature worms cause marked pathological changes in the biliary tract, mechanical irritation, as well as by the toxic secretion. They produce cystic dilation of the bile ducts, the walls of which become greatly thickened by the development of this tissue. So, diagnosis, this is based on the finding of eggs in stool or bile obtained by duodenal incubation. Patients may be symptomatic during the first week of infection, but no eggs will be found in the stool until the worms mature, which will eventually takes around 8 weeks. Multiple stool examination may be needed to detect this light infection, moderate to high eosinophilia. So the eggs can be found in the stool. However, they may be absent more often than in infection with Fasciola hepatica. So multiple stool examination may be required to demonstrate the eggs. Recovery of adult flukes at surgery would confirm the diagnosis. Treatment in human infection, emetine injection has been attended with beneficial results. This bithionol is now the drug of choice for fascioliasis. Triclebendazole as a single dose is also recommended. The drug is given orally in single or multiple doses and has few side effects. It acts by inhibiting protein synthesis in Fasciola hepatica and will probably become the drug of choice for this treatment. Next is nematodes, that is nothing but roundworms. So all the important human parasites of the phylum Nemathelminthes belong to the class nematodes. Nematoda. General characteristics of these nematodes, they are unsegmented, elongated, and cylindrical in shape. They have separate sexes with separate appearances and each other via hormones. They have a tough protective covering or cuticle. They have a complete digestive tract with both oral and anal openings. The nematodes are free living majority, that is, or parasite of humans, plants, or animals. So the parasitic nematodes, the nematodes are generally light cream white in colored. Their life cycle includes eggs, larva, and adult stage. The parasitic nematodes are divided into two parts. First is intestinal nematodes with tissue stage, which is roundworms. Ascaris lumbricoids, this is roundworms. Second is hookworms, which is nectar and cyclostoma larval migrants. And last is threadworms. So we'll go one by one. Intestinal nematodes will start with Ascaris lumbricoids. Here, these are common roundworms infecting more than 700 million people worldwide. Its morphology, male adult worms measures around 15 to 20 centimeter in length. The posterior end is curved ventrally. The female worm of this Ascaris measures around 20 to 40 centimeter in length. Its posterior end is straight. This infective stage and modes of infection. Here, the egg containing larva, when ingested with contaminated raw vegetable, causes ascariasis. Its life cycle: roundworms infect in human via the fecal oral route. Eggs then released by the adult female are shed in feces. The eggs are ingested via food. Ingested eggs hatch in the duodenum into larva. The larva then penetrate the intestinal wall and circulate in the blood to the lungs before entering the throat. So the person may either swallow or cough out the larva. If swallowed, the larva move to the intestine via the trachea, descending the esophagus and finally reach the small intestine to become adults. So the female pass immature egg will pass to the soil and mature in 2 weeks. Pathogenicity and clinical features: Ascaris may not cause symptoms at first. However, as the infestation inside the small intestine it grows, a person may notice symptoms such as abdominal pain, growth retardation, loss of appetite, worms visible in stool, vomiting, impaired growth in children, weight loss, nausea, diarrhea, and irregular bowel movements. So, in advanced infection, the worms may travel to the lungs and may present symptoms such as fever, discomfort in the chest, gagging cough, bloody mucus, shortness of breath, and wheezing. So, in rare cases, the person may also experience a complication which is known as aspiration pneumonia, which is Loeffler's syndrome. This syndrome. Diagnosis: examination of stool for eggs by direct saline smear method or demonstration of adult worms via imaging techniques such as endoscopy, which look inside the intestine, CT scan, MRI, ultrasound, and X-ray of egg ascaris lumbricoids. Treatment: mebendazole, albendazole, and surgery to remove large number of worms will be done. Prevention: wash food properly and wash hand after using the bathroom. Filter and boil water before drinking. Peel and cook any vegetable or food grown in unsanitary condition. Ensure children clean their hand with soap and water after playing outside. This is the life cycle of Ascaris lumbricoids. It is inside the body of host, this part, and this is the external environment. How it causes infection: these are the eggs of Ascaris lumbricoids. Next is Encyclomata duodenal. So, hookworm is an intestinal parasite of humans. The larva and the adults live in the small intestine of the host, causing intestinal diseases. There are two species of hookworms. First is Encyclostoma, and second, which is also known as Encyclostoma duodenal, and second is Necator americanus. So the adults are found in the small intestines of men. Mixed infection is common. The eggs are passed in feces of an infected person. The eggs hatch into larvae which can penetrate. Of the larva can also cause infection. Main reason of infection. So, we'll start with this cyclostoma duodenal. Sir, it is showing my internet connection is unstable. Am I audible?
Yes, madam.
Hello?
Hello,
Sir,
audible, ma'am.
am I audible properly?
No. Some
This
network issue is there.
form are found in this small intestine. Sir, I'll switch this Wi-Fi.
Hello.
Hello, sir.
Tell
Sir,
madam.
some network.
Tell madam.
Hello.
Yeah, please continue.
Oh, okay, sir. So, Ankylostoma duodenal, these are grayish white in color. The body is slightly ventrically curved. The anterior end follows the body curvature. The buccal cavity is provided ventrally with pairs of teeth and dorsally with a notched dental plate. Distribution of this species is found generally in the northern part, including China, Japan, Europe, North Africa, and Ethiopia. Morphology of this ankylostoma, male, the male measures around 10 centimeter in length. The posterior end is broadened into a membranous copulatory bursa that is provided with two long spicules. The female of this ankylostoma measures around 12 centimeter in length. The posterior end is straight. Second is Nectar americanus. This species, so-called American hookworm, is found in predominantly the tropics. The anterior end is hooked against the body curvature. The mouth is provided ventrally and dorsally with cutting plate. So morphology, male of this nectar hookworm is measures around 8 centimeter in length. The posterior end is broadened into a membranous copulatory bursa, which is provided with two long spicules, first distally. Female measures around 10 centimeter in length. The posterior end is straight. The infective stage and method of infection. The larva form infects by skin penetration. So life cycle of this hookworm, adult male and female worms live in the intestine, small intestine. The female lays egg which is oval around 60 to 40 microns, which contain immature embryo in the 4-cell stage. When the egg pass in the stool to the soil and under favorable conditions of temperature, moisture and oxygen, they hatch into larva. So the released Rebatidium larval grow in the feces or soil, and after 5 to 10 days they become form that are infective. When this form of larva penetrate through the skin, they circulate in the blood to the heart, then it reaches the lung which ascend to the trachea and descend to esophagus to reach the small intestine, and where they reside and become adults. So some of this larva following penetration of the skin can become dormant in the intestine and muscles. So life cycle of this and hookworms and pathogenicity, skin rash on area that is typically red and itchy, weight loss, loss of appetite, breathing complications such as wheezing and cough, fever, stomach pain, diarrhea, extreme tiredness and weakness, iron deficiency, anemia or malnutrition. The larva cause inflammation of the lungs also. So diagnosis, examination of stool by direct saline smear to detect the eggs, blood samples to check for the presence of anemia or a lack of certain nutrients. Treatments, bendazole, albendazole or parental pamode tablet will be given for daily 2 to 3 days. Those with anemia can be given iron supplements as well. Prevention, avoid walking barefoot in areas where hookworms are very common. Use barriers to prevent the skin from touching the soil when sitting on the ground. Avoid consuming soil or unwashed food that may be contaminated by hookworms. Avoid defecating outdoors. Avoid the use of human feces as fertilizers. Effective sewage disposal system is must. Next is Anterobius vermicularis, that is pinworm. So Anterobius vermicularis is a small white worm with thread-like appearance. The worm causes enterobiasis. Infection is very common in children. So morphology, male measures around 2 to 5 mm in length. The posterior end is curved and carries a single copulatory spicule. Female, the female measures around 8 to 13 mm in length. The posterior end is straight. Infective stage is by ingestion of eggs containing larvae with contaminated raw vegetables. Mode of infection, by direct infection from a patient that is fecal or oral route. Autoinfection, the eggs are infective as soon as they are passed by the female worm. If the hands patients get contaminated with these eggs, he or she will infect him or herself again and again with this infection once if it is infected. So person to person infection can also occur through hand handling of contaminated clothes or bed linens. This contaminated clothes or bed linens. Enterobiasis may also be acquired through surfaces in the environment that are contaminated with pinworm eggs, example carpets and curtains. Some small number of eggs may become airborne and inhaled. So the life cycle of this pinworm, adult worm lives in the large intestine. After fertilization, the male dies and the females move out through the anus to glue its egg on the perianal skin. These take place by night when the eggs are swallowed. They hatch in the small intestine and the larvae migrate to the large intestine to become adult. The time interval from ingestion of infective eggs to oviposition by the adult female is about 1 month. So the lifespan of the adults is about 2 months. Gravid females migrates nocturnally outside the anus and ovipostates eggs once more. So life cycle of this vermicularis is done inside the intestine. Clinical presentation, the migration of the worms causes allergic reactions around the anus and during night it causes nocturnal itching, and these worms may obstruct the appendix, causing appendicitis, which is very rare. Diagnosis, eggs in stool, examination of the stool by direct saline smear to detect the egg. This is positive in about 5% of cases because the eggs are glued to the perianal skin. Perianal swab, the perianal region is swabbed with a piece of adhesive tape hold over a tongue depressor. The adhesive tape is placed on a glass slide and examined for this presence of X. The swab should be done in the early morning before bathing and defecation. So presence of this egg will confirm the infection caused through pinworm Enterobius vermicularis. Treatment, again mebendazole and albendazole, pyrantel, pamor, all this will be given as the drug of choice. Prevention and control, washing your hand with soap and warm water after using the toilets, changing diapers and before handling food. To prevent auto-infection, the infected patient should bath every morning to help remove large amount of eggs on the skin. Cutting fingernails regularly and avoid biting nails and scratching the anus. Frequent changing of underclothes and bed linens help to prevent transmission of eggs in the environment. Next is threadworms. These strongyloids, so this transmission is through again skin penetration, and again in this case autoinfection is possible. Clinical features and pathogenesis of this threadworm include diarrhea, pneumonia, and disseminated infection in immunocompromised or immunocompetent individuals having underlying health issues. Diagnosis, again through larval presence of larval eggs in stool. Treatment of choice is thiabendazole for this threadworm. This is the life cycle of strongyloids stercoralis in the body of host and external environment. This is the larva of this threadworm. Next is Trichuris trichuria, which is whipworm. The worm is divided into a thin whip-like anterior part measuring around 3 to 5th of the worm and a thick fleshy posterior part of the length. Male measures around 3 to 4.5 centimeter in length. Its posterior end is coiled and possesses a single cubicle. The female measures around 4 to 5 centimeter in length. Its posterior end is straight. So infective stage and mode of infection is by ingestion of eggs containing larvae with contaminated raw vegetables. Life cycle, the unembryonated eggs are passed with stool in the soil that develop into a two-cell stage an advanced cleavage stage, and then embryonated. So eggs become infective in around 15 to 30 days. After ingestion via soil contaminated hands or food, the eggs will then hatch in the small intestine and release larvae that mature and establish themselves in the large intestine where they become adults. After mating, the female lays immature eggs which pass with the stool to the soil and mature in 2 weeks. Symptoms: people with heavy infections experiences frequent painful passage of stool that contain a mixture of mucus, blood and water. Rectal prolapse can also occur. Heavy infection in children can lead to severe anemia, growth retardation and impaired cognitive development. Diagnosis is through microscopic identification of eggs in the stool sample. Example: egg of trichuris trichuria. Treatment of choice: albendazole and mebendazole will be given. Prevention of this um, whipworm: avoid ingestion soil that may be contaminated by human feces, including where human fecal matter or wastewater is used to fertilize crops. Wash your hands with soap and water before handling food. Teach children the importance of washing hands to prevent infections. Wash, peel, and cook all raw vegetables and fruits before eating, particularly those that have been grown in soil that has been fertilized with manure. Next is Trichinella spiroiasis, which is trichinosis. Its transmission is through undercooked pork, meat, flesh. Clinical features include intestinal phase, which will cause diarrhea, muscle phase, myelina, periorbital edema, which is swelling, myocarditis. Diagnosis is through muscle biopsy or serological test. Treatment of choice: these drugs will be given to cure the patient. Next is Dracuculus medinensis, which is Guinea worm or Medinia worm. It will cause dracunculiasis. The infection is endemic to Asia and Africa as well as in India. Morphology: gravid female worms measure around 70 to 120 centimeter in length. The body cavity is almost fully occupied by a uterus, greatly distended with rhabditiform larva, which is around 250 to 750 μm in length. A digestive tube and cuticular annulations distinguish the larva from microfilariae. So pathogenicity and life cycle: infection is acquired by drinking unfiltered or non-boiled water that contains copepods, which is small crustaceans which are infected by the larva. Following ingestion, the larvae are released in the stomach, penetrate the intestinal wall and their way to the subcutaneous tissue. After maturation, mating takes place in the axillary or inguinal regions. 3 months after infection, the male worms then die in the tissue and the female worms move down to the limbs within 10 months in the subcutaneous tissue. So, in about 1 year, female worms in the subcutaneous tissue provoke the formation of a burning blister in the skin of the legs, which ruptures, which in contact with water, the blisters burst and about 5 centimeter of the worm is released from the resulting ulcer, thus releasing many thousands of first stage larvae. These larvae swim in water and are ingested by the intermediate host, which is copepod of cyclops species. Within about 4 days, inside the cyclops, the larva molt twice and become infective in 2 weeks. So these clinical features: the female parasite in the subcutaneous tissue release toxic byproducts of histamine like nature, which causes systemic allergic reactions like erythema, reddening of the skin, urticaria, proteosis, which is severe itching of the skin, fainting, asthma, dyspnea, etc. This is followed by the appearance of a blister on the legs, which ruptures on contact with water, releasing larvae into the water by the female worms. The wound may ulcerate, the worms migrate into other tissues and may cause arthritis, which will cause pain a lot, and the worms migrate into other tissues, pericarditis, abscesses, etc. It occasionally penetrates the eyeball and cause loss of the eyesight as well. So diagnosis, clinical observation of these blisters for worm or larva, histologic features of subcutaneous sinus tract, eosinophilia, and radiographic evidence of the presence of the worm. Treatment, excision when the worm is in the leg. First, each day the affected body part is immersed in a container of water to encourage more of the worm to come out. To prevent contamination, the infected person is not allowed to enter drinking water sources. Next, the wound is cleaned, then gentle traction is applied to the worm to slowly pull it out. Pulling stops when resistance is met to avoid breaking the worm. Because the worm can be as long as 1 meter in length, full extraction can take several days to weeks. The worm is then wrapped around a rolled piece of gauze or a stick to maintain some tension on the worm and encourage more of the worm to emerge. This also prevents the worm from slipping back inside. Afterwards, topical antibiotics are applied to the wound to prevent secondary bacterial infections. The affected body part is then bandaged with fresh gauze to protect the site. Medicines such as aspirin or ibuprofen are given to help ease the pain of this process and reduce inflammation. These steps are repeated every day until the whole worm of this guinea pig is successfully pulled out. Prevention, health education on boiling or filtering of drinking water, treating of treating of patients to prevent using insect larvicides to kill cyclops in water. Next is filarial worm, so which is Wucheria bancrofti. Its vector is through mosquito bite. Clinical symptoms include lymphatic filariasis, which is also called elephantiasis, hydrocele, and lymphangitis. Diagnosis is through microphilia in blood. Night samples will be given to test and serological tests. Treatment, this diethyl carbamazine DEC will be given. Prevention is through mosquito control or bed nets. This is the life cycle of Wucheria bancrofti. Other filial worms include Onchocerca volvulus, which is a river blindness transmitted by black fly. Next is Loa loa, which is eyeworm transmitted by Chrysops fly. Next is clinical skin nodules, dermatitis, corneal opacity, caliber swelling. Treatment is through ivermectin, Onchocerca, DEC, albendazole for Loa loa. Next is cystode, which is nothing but tapeworms. The tapeworms are hermaphroditic and require an intermediate host. The adult tapeworms found in humans have fat body while white or grayish in color. They consist of an anterior attachment organ or scolex and an achene of segments, also called strobila. The strobila is the entire body except the scolex. So the scolex or grooves, it has the rostelium, which has one or two rows of hooks situated on the center of the scolex. Adult tapeworms inhabit the small intestine where they live attached to the mucosa. These tapeworms do not have a digestive system. Their food is absorbed from the host intestine. So transmission is through undercooked pork through intestinal teniasis. Clinical features include abdominal pain, epilepsy. Diagnosis is through stool examination, presence of proglotted eggs, imaging, presence of cyst. Treatment, choice of drugs will be given to treat patients having infection through cystodes. Next is Tinea saginata, which is beef tapeworm. So this transmission is through again undercooked beef meat. Clinical features include intestinal infection, no cysticercosis. Diagnosis is through stool microscopy and proglottoids. Treatment is praziquantel. This pork tapeworm, Tinea solium is reside or inhabit the upper part of the small intestine. Infection has worldwide distribution. So these parasitic infection caused by three tapeworm species, Tinea saginata, which is known as the beef tapeworms, Tinea solium, which is pork tapeworm, and last is Tinea asiatica, which is Asian tapeworm. So humans are the only host for these Tinea tapeworms. Humans pass the tapeworm segments or eggs in feces and contaminate the soil in areas where sanitation is very poor. Tinea eggs can survive in moist environment and remain infective for days to months. Cows and pigs become infected after feeding in areas that are contaminated with tinea eggs from human feces. Once inside the cow or pig, the tinea eggs hatch in the animal's intestine and migrate to striated muscles to develop into cysticercosis, causing a disease known as cysticercosis. So, here, cysticerci can survive for several years in animal muscles. Humans become infected with tapeworms when they eat raw or undercooked beef or pork containing infective uh, tinea. Once inside human, it will migrate to the small intestine and mature to adult tapeworms, which produce segments and eggs that are passed in feces. So diagnosis is through stool examination for the presence of gravid segments or the eggs. Treatment, drug of choice will be given. Next is Echinococcus granulosus, which is hydatid worms. Echinococcus, there are two different species. These are Echinococcus granulosus and Echinococcus multilocularis. So there are two species. Echinococcus granulosus is dog tapeworm, responsible for most cases of echinococciasis. Echinococciasis is caused by larval tapeworms. The disease is common in East Africa. The highest prevalence is seen in Kenya, which is 10 to 15%. Its morphology, the adult worm measures around 3 to 6 mm in length up to 1 centimeter. Its Hascolex neck and strobilia. Adult worms live in small intestine of definitive host, which is nothing but dog. Men is an intermediate host carrying the hydid cyst, which is larva. Man contracts infection by swallowing eggs in excreta of definitive host. Life cycle and pathogenicity. Oncosphere hatch in duodenum or small intestine into embryos which penetrate wall, enter portal veins, and then migrate via portal. Blood supply to organs, example lungs, liver, brain, etc., thus causing the extra-intestinal infection. In these organs, larvae develop into hydatid cysts. The cyst may be large, filled with clear fluid and contain characteristic prostocoliasis, which is immature forms of the head of the parasite. These mature into develop, which are infective for dogs. So mode of human infection is through ingestion of egg by the following ways: ingestion of water or vegetables polluted by infected dog feces, handling or caressing infected dogs where the hairs are usually contaminated with the eggs. Clinical features include asymptomatic infection is common, but in symptomatic patients, it may cause cough with hepatosis in lung, Hydatid disease, hepatomegaly with abdominal pain and discomfort, pressure from expanding cyst, rupture of cyst, and severe allergic reaction as well, and anaphylaxis. Diagnosis is through X-ray or other body scans, demonstration of protocoliasis in cyst after operation, serological test as well. Treatment, surgery, albendazole, which will be given twice a day for 1 to 8 periods of 28 days each, separated by drug-free rest intervals, which is around 14 to 28 days. This albendazole plus surgical removal will be given through paid method. This is the life cycle of Echinococcus granulosus. Next is fish tapeworm. So here the broad tapeworm infecting man has worldwide distribution, occurring in areas where improperly cooked or raw freshwater fish is prominent in diet. Morphology, this Diphyllobotrium latum is the broadest and longest tapeworm. The adult worm measures up to 30 feet with 3,000 to 4,000 proglottids, which are wider than they are long. The tapeworm has neurostellum hooks or suckers. Life cycle: unlike Taenia, the gravid segments are retained by the worms. Eggs passed in feces hatch into small ciliated coracidium larvae which swim about freely. These are eaten by crustaceans, cyclops, or diaptomus, in which the larvae develop into second stage larvae. The procercoid: when the crustaceans are swallowed by freshwater fish, the larvae migrate into fresh flesh of the mussel fish and develop to this. Humans are infected by ingesting raw or improperly cooked fish. The tapeworm matures in the intestine, and after 3 weeks, the adult worm discharges eggs. The life cycle requires two intermediate hosts to complete the infection. Clinical manifestations include: most infections are asymptomatic, rarely it causes severe cramping, abdominal pain, vomiting, weakness, and weight loss. Anemia can also result due to interference of vitamin B12 absorption, deficiency of vitamin B12. Diagnosis: identification of eggs in stool, single shell with operculum at one end and a knob on the other. Treatment: nicotinamide will be given or praziquantel will be given to the patients. Prevention: prohibiting the disposal of untreated sewage into fresh water or lakes, cooking of all freshwater fish properly. Next is dwarf tapeworm. So, adult worm measures 1 to 3 centimeter in length. It is made up of head, neck, and segmented body. The head carries 4 suckers and a rostellum armed with one row of hooks. The segments of the body are divided into mature and gravid segments. In the mature segment, there are 3 testes in the middle. Mode of infection: the egg, which is immediately infective when passed by the patient, is rounded about 40 microns in diameter. It contains 6 hooked oncosphere within a rigid membrane. This embryosphere has two polar thickening from which project these polar filaments. So infection takes place through ingestion of egg with contaminated raw vegetable, direct infection from a patient, autoinfection. The eggs of Nana are infective as soon as they are passed with feces by the patient. If the hands of the patient are contaminated by these eggs, she or he infect herself again and again. So these should be immediately infective when passed with the stool and cannot survive more than 10 days in the external environment. When eggs are ingested by this arthropod intermediate host, which may cause various species of beetles and fleas as an intermediate host. So, the clinical features include abdominal pain, diarrhea, and anorexia, which especially occurs in children. Diagnosis is through stool exam. Eggs will be seen with polar fragments. Treatment: nicotinamide and praziquantel will be given to the patient. So, summary: today's class we include all helminthes, trematode which causes schistosoma and fasciola. Next is nematode which will cause through ascaris and cyclostoma, enterobius and strongyloids. Trichuris, trichinella, Dracuculus, Wuchereria and other. Cystodes, Taenia species include Echinococcus, Diphyllobothrium, Hyamenolapsus. Common include all these three: transmission, clinical, and prevention. Clinical features and prevention. Transmission is through generally contaminated food, water, soil, or vectors. Clinical features mostly include anemia, malnutrition, and organ damage. Prevention: hygiene is must, cooking food properly, and vector control. So questions for 3 marks. First, define helminthology and name the three major classes of helminths. Second, list two sources of parasite transmission in humans with example. Third, write two clinical features of schistosoma hematobium infection. Fourth, state the infective stage and mode of transmission of Ascaris lumbricoides. Fifth, mention two complications caused by hookworm infection. Sixth, what is the diagnostic method for Enterobius vermicularis? Seventh, name two clinical features of trichuris trichuria infection. Eighth, give two preventive measures for dracunculus medinensis. Ninth, what is the causative agent of Hydatid disease and its definitive host? Last is name the parasite associated with vitamin B12 deficiency and its mode of infection. Questions for 5 marks. First, describe the life cycle of Schistosoma mansoni. Second, explain the pathogenesis, clinical features, and treatment of Fasciola hepatica. Third, discuss the life cycle and complication of Ascaris lumbricoides. Fourth, explain the transmission, clinical features, and diagnosis of hookworm infection. Fifth, write a short note on strongyloids stercoralis with emphasis on autoinfection. Sixth, describe the clinical features, diagnosis, and prevention of Trichinella spiralis infection. 7. Discuss the morphology, life cycle, and clinical importance of Wucheria bancrofti. 8th is explain the mode of infection, clinical features, and diagnosis of Tinea solium, which is nothing but coke tapeworm. 9th, write a note on Echinococcus granulosus, which is Hydatid disease, including diagnosis and treatment as well. Last, describe the transmission, clinical features, and laboratory diagnosis of Diphyllobothrium latum. So, helminths is covered in today's class.
Thank you, madam. Thank you so much.
Yes, sir. Next class, I'll cover
Helminthology.
arthropods. Only one topic is remaining and
Yeah,
lab diagnosis. So, inshallah, we'll cover that in next class.
yeah. Actually, in between there was a gap
Yes,
because,
sir.
okay, no issue, but we will cover it.
Yes, sir. We'll cover it
Yeah.
soon. All right,
So
sir.
today
Thank you, sir.
helminthology it's completed, I think.
Yes, sir. Helminth, this is fully
Actually
completed.
repeated. It is repeated, I
Yes,
think.
sir. Actually, I thought I'll cover soon and I'll start with arthropods, but
Yeah, yeah,
this only took 1 hour. So
yeah,
arthropod is a lengthy topic. That is why I didn't start it today.
yeah. And in between there was some net issue also. I
Yes,
thought
sir. I
again.
don't know. Here,
So
some network issue is going on.
helminthology only it's happening like this, I think.
Yes, sir. That
So,
is why I thought
okay.
I'll repeat this class, but again, network issue was there.
Yeah, yeah, ma'am. Okay, ma'am. Thank you so
All
much.
right, sir. Thank you
Good.
so much.
Thank you.
Thank
Thank you,
you.
madam.